We should remember that facial proportion is crucial to do correct or natural anti-aging, because as I showed you in my presentation, what happens to us as we age, as when we are young, the face looks mainly like this, very narrow down and very, wide upwards. But as we age, the face turns to be like a very straight, wider here and less fat here, so we get like a straight figure like this. And this straight figure is something which is not feminine, not sexy. So when we are treating patients, it's not only about filling and filling and filling. And if a patient comes to you and she tells you fill up these wrinkles, I said no, you have to push back up those cheeks in order to create a feminine look, a natural, attractive, sexy look. And then after you achieve that, you can fill up wrinkles. So first of all, when I look at my patient, I try to stick back to their own proportions, because we have different facial shapes. We are not all the same. Some people are round, some people are oval, some people have triangle faces. We have to stick to their own proportion, because we have to keep in mind that we cannot totally make a change. We have to stick to the normal structure of the patient and just to make it better, just to take it back a few years. That's a very good question, because today more and more we're facing younger population. I am in this business for about 12 years, and in the beginning most of my patients were older than me, in their 50s, 60s, and now most of my patients are younger than me. That's quite embarrassing, because people now in their beginning of 30s, something like that, we have a lot of patients in their 30s and early 40s which come to you. And of course, you cannot treat them as a 50, 60-year-old patient, because young patients are looking for maintenance, for beautification, for making a sexier appearance, not because they look old, but they look a little bit tired, a little bit less sexy, less feminine, and this is how we have to approach them. It's a totally different approach. We use different products in order to achieve these results. We should remember that although we take pictures of our patients like this, patients are moving. When they go out of your room, they start to move, and you have to take that into consideration, because if you inject, for example, for a moving area like the cheeks here, you inject a very strong product. First of all, it will look like lumps and bumps, and whenever the patient is doing like this animation, it will stick out, it will project out. So when we are treating those areas which move, and the lower part of the face moves, our lips move. Okay, for example, the temple area doesn't move, the cheekbone area doesn't move. So when we are treating moving areas, we need flexible products. And again, we have varying degrees of flexibility of product to adapt it to the special patient, according to the skin, according to the indication. There are a lot of parameters which are considered here. It looks a very impressive congress. This is my first time in this congress, and I'm very enthusiastic over taking part of such a big conference. And it's so far it's really a big, I find it like a big honor to take part in such a congress.